Minnesota's Medical Cannabis Program is providing relief for patients who face challenging medical conditions. Listen to Mike's story to learn how medical cannabis is improving his quality of life.
My name is Mike Kelash. I'm retired with my wife. I have 4 grandchildren who are awesome, a son and daughter-in-law in my life, and it's fulfilling and wonderful just to have them around. I was diagnosed with esophageal cancer in 2018.
I became involved with the Minnesota Medical Cannabis Program probably shortly after it launched in 2015. I've certified patients in the program, and I've also collaborated with the Department of Health on a number of research projects. I am a medical oncologist, and my clinic predominantly is seeing patients with advanced cancers, typically undergoing cancer-directed treatment.
And I went into chemo and radiation right away, and then they operated removing the cancer tumor. It leaked. I ended up over at the University of Minnesota for a couple of months with tubes all over me. But they kept me alive, and I came home in like December, just before Christmas, at those 2 months. And then it's been 3 or 4 years with cancer-free, and now it showed up again on my liver. So we'll see what that brings about.
I think medical cannabis has a real potential to impact our patients' quality of life in cancer. Cannabis is unique in that it's not just one drug, it's a drug that has multiple potential things that it can improve. And so our patients are struggling often with pain and nausea and insomnia and anxiety, and this is a drug that potentially can impact all of those for the better. So a big reason that our patients with cancer end up using cannabis is for pain management. Pain in cancer patients is often very different than other chronic type pain. The pain is generally dictated by what the cancer is doing. If a patient's cancer is improving from their therapies, their pain may be better. However, if their cancer is progressing, their pain may actually be worse, regardless of the treatments that are being administered. Again, back to the research, sometimes we don't see significant levels of pain change. The scores that patients may report aren't changing very much. However, they still tell us that they feel better, that their pain is better managed, they feel like they can get through their days better. And there may also be some other reasons for that. Patients generally feel that their sleep is dramatically improved with cannabis. I think that's actually one of the universal things I've seen in most patients. From a pain standpoint, if your sleep is better, you generally wake up the next day feeling more energetic, you have a better emotional kind of aspect to start the day with, and potentially just get through the challenges that may come of that day, whether it's pain or nausea or other symptoms from their cancer journey.
This is a gift from my granddaughter and daughter. I was in the hospital for a couple of months recovering from my surgery. So my granddaughter got the idea that I should have these beads, and then when I'm down and I'm sad, that I can just rub those beads and think of her and her mother, and that would make me feel better. And so I've kept them because they mean quite a bit to me now. And I think she was right too.
So I think the future for medical cannabis is full of opportunities, and our patients with cancer need hope. And I always want to hope that we can advance this field, that we can find more research funding, that we can continue to do good work in this area. And hopefully with that in mind, we'll be able to provide data and evidence to patients, to their providers, to the payers, and to ultimately policymakers to help them show where cannabis has its role.
My quality of life has much improved since I started taking medical cannabis. It keeps me even keeled as far as the pain goes. It still allows me to do things that I enjoy to do. And if I need to adjust my amount, I can feel free to do that without really huge side effects that other medications might cause. I feel like I can just go out anytime and do what I want. I don't drive, so I don't have to worry about the effects of the cannabis and driving, but it is just getting out, shopping, doing those things that fill up a life, you know?